Hi, and welcome to the Health 2.0 conference here in Las Vegas. I'm Danny, your host, and we have our next guest joining us, Kingsley. If you can introduce yourself from as a clinical pharmacist at Aya Healthcare, is that correct?
That's correct.
Perfect. And I know you just flew in from Florida, right?
I did.
But you have a couple stations, Dallas, Florida. Tell us a little about yourself.
Yeah, sure. So
Yeah.
my name is Kingsley Ugoji. I'm a clinical pharmacist, also with Aya Healthcare, and then also as an independent consultant, where I kind of go to different hospitals, provide my expertise, my knowledge, etc., for maybe about 3 months, and then move on to the next. So last year, I had like 3 contracts in Florida, so I was kind of bouncing around all of Florida in the different hospital systems. Then I came here at this wonderful conference, Health 2.0.
Wonderful.
And then I will return back to my home base, which is Dallas, Texas.
So in Dallas, then, do you work out of a hospital, or do you work out of like a couple clinics, or how does that work?
Yeah. So technically, because I got my start in clinical pharmacy in Dallas. So there I did work for a hospital, Texas Health Resources. However, in this new chapter, ever growing, ever evolving, returning back to my home base, Dallas, I will be still in the contract space, but then that will actually be hospitals in the northwest, where I'll be on the informatics side, kind of helping build up the EHR systems, because they're switching EHR systems in that particular health system.
What is EHR?
EHR, Electronic Health Record or Health System. That is kind of the program that kind of runs within the hospitals. So when you give, when we're seeing patient Jane Doe, the name, the age, what are their, comorbidities, that's kind of the system that kind of encapsulates all of that information,
What advice would you give someone starting in your field? Because you kind of do consulting,
Yes.
but you also do like telehealth, what you were mentioning.
Yes.
And then you're also a clinical pharmacist. So you kind of you got a lot of pockets.
Yeah.
Got a lot of genres.
Yeah, so what would I say is definitely find your uniqueness and don't lose that, I guess you can say. Like for me, I am in pharmacy. I would say maybe pharmacy is kind of more so a little bit boxy. Who is the patient? Is this the correct drug? Is this, it's very, very line item by line item by line item. And obviously, if you can tell by my personality, I'm not like that kind. I'm not a type A kind of person.
Yes.
So for me, traveling, trying different things, that's kind of me just, in a way, expressing myself. I am in this field called pharmacy, but then also expressing what do I like, what do I not like, and then also kind of taking a hold of everything and kind of charting my own territory in a way.
Absolutely. I feel like that's necessary. I feel like that is like the change, especially after COVID. Because I know a lot of things changed, especially in healthcare. So especially with I would say consulting too. It gives you, I feel like, more flexibility with everything becoming more, electronic, essentially.
That's correct.
Yeah, and so you did receive the Health 2.0 Conference Honorary Award. How did you feel about that?
I feel delighted. It's an honor. It really is an honor. And I think Health 2.0 is a wonderful organization. I don't know how they procured each and every individual or each participant, but it's wonderful to be amongst my peers, everyone thriving and doing what they're doing in their respective fields. So for me to be a part of that, it just, it is an honor.
Yes, wonderful. And so let's see what we got next. Biggest opportunity for impact over the next 5 years. What do you see?
Biggest opportunity over the next 5 years.
Because everything is like AI this and AI that, So
two things is to hone in on your uniqueness and always be ahead of the curve. I think if you can do those two things, that's the biggest impact.
How do you get ahead of the curve?
How do I get? Because it comes naturally as an Aquarius, but no, but.
Oh my God!
I'm sorry. No, but more seriously, but staying observant in the landscape. I mean, we're already global. Globalization is here.
Yes.
Obviously, AI, technology, the internet, it's pervasive in every corner of our lives.
Yes.
And so seeing that, kind of predicting maybe what will happen in the future, and then using that to kind of strategically make decisions now while being your unique self, because that's how you stand out in a world that are full of normals.
Full of normals.
Yeah.
Oh my God.
I don't want to be a muggle.
Not a muggle.
I want to be Harry Potter, but
hey. Thank you so much for joining us. This has been absolutely lovely. And what's the best place for you to LinkedIn? Do you have a website?
No, yeah, it would be LinkedIn.
Okay. And it's Kingsley. Can you just pronounce your last name?
Yeah, last name is Ugoji. Ugoji.
Yes, that's perfect. Thank you so much, Kingsley, and have a great rest of your conference.
Likewise, thank you.
Yes.